I want to bring my good friend Dr. Joe Congeni to the Children's Hospital. Good morning, Joe.
Hi, Ray. How are you?
I'm doing well. What do you have for us today?
Well, this time of year, really any time of year, but this time of year it seems more so. There's a lot of kids and parents and medical people that are asking questions. One of the most common infections that kids get in teenage years and even junior high school, and college is mono, infectious mono. And infectious mono has sports has an effect on kids that have mono in that kids are really at risk if they play contact sports like football and soccer and they have had mono infections. And so, but this is really very confusing to people, and I wanted to try to clear it up a little this morning, Ray. So, the problem is that kids in that age range, junior high, high school, and college, that have mono could have a very variable presentation. Many may just get a little runny nose, a little stuffy upper head cold, and really not get much in the way of symptoms at all and still have a mono infection. But of course, the one we know more is kids who get start out with a little upper respiratory infection, seems like just a run-of-the-mill virus, but then they start getting significant sore throat and redness and swollen glands and tiredness and issues like that make it an infant. Then the big problem is for sports that we always worry about on the sidelines is as the body begins to battle that infection, the spleen, which is what cleans out some of the blood cells, is going about its business of all these extra blood cells that are out there to fight the infection. The spleen increases in size. It doubles or more than doubles in size, and then many cases a year, a handful, 7, 10, 15, end up in the emergency room where kids get hit in the stomach, in the abdomen, the left side of the abdomen, and they can rupture their spleen or tear their spleen or injure their spleen and bleed around the area of the spleen, and then we really have a problem on our hands. So being aware of kids having mono. So I just wanted to clear up. The typical period of time is for the first week, kids might have just a general infection and the body is beget off. The second week, the infection really kind of begins to have its way and kids are sicker and they miss time and they're contagious to other kids. The third week is the week that the body really starts to fight this thing. And there's no good antibiotics, steroids people have tried, other medicines. There's nothing else other than the body's immune system fighting this infection off. And it's during that second and third week where the body's fighting the infection that we get all this increase of certain types of white blood cells that causes the spleen to enlarge. And it isn't until the fourth week that the spleen goes down in size. So for kids who practice really hard and they want to play so bad, it's about 4 full weeks before they can return to soccer or football or other contact sports because they could be at significant risk of rupturing their spleen.
Wow, that's dangerous.
Yeah, and so you end up with a kid ends up having to have a splenectomy, taking the spleen out because they had a mono infection. So it is kind of important to know. So when kids have these infections and they're beginning to last a little longer and really bad sore throat and swollen glands, and fever, that's when they really need to be evaluated to see if they might have a mono infection if they're in the sports world, if they're playing those contact sports like soccer and football, basketball season. There are simple blood tests that we can do to tell whether that infection is just any run-of-the-mill virus or is it the monovirus called Epstein-Barr virus. And if it is, and they're in a contact sport, we really need to know about it or it will be dangerous. And that's why I really, I appreciate always the chance to get on your show and talk to people and parents about this. They don't understand why would a kid with a mono have to be held out of sport? And exactly the reason is the risk of spleen rupture or spleen injury.
Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital, joining us, 1590 WAKR. Joe, I was seeing earlier this morning, even though a lot of schools have canceled school today, there were some football teams out practicing this morning under the lights at 6 o'clock in the morning to stay out of that heat this afternoon.
coolest time of the day, Ray, for sure. I had a few schools, too, that I work with that moved it to later last night, twilight. But twilight wasn't that cool last night either. So you're exactly right. And that's one of the really good techniques, is to move practice. By the time we get to this time of year, I feel a little better, Ray, because the kids are acclimatized. The certified athletic trainers have been checking weights and seeing who's getting dehydrated. The practices are more geared towards plays and specifically what's the other team doing and plays and things, rather than just conditioning. You know, those first August practices that are very long and very much geared towards just conditioning are the ones that I'm at most risk. But definitely when we have 3 days in the 90s, did I hear, Ray, that we've had over 20 days of 90-degree temperatures this summer?
Yeah, we have. It's been a hot
one. Wow. But luckily, as happens a lot it is supposed to blow out of here by the end of the week, and we're going to get back to more typical average temperatures for the weekend.
Yeah, that's for sure. It looks like starting to 75, 78 degrees for sure.
So make sure those athletes haven't been dehydrated.
Right.
Check their weights. Make sure that they're hydrating before we get into the weekend, and keep all those kids safe, and look out for those signs of mono also. That can be a big issue for teenage athletes.
Joe, great stuff again. Good talking with you. We'll catch up with you next Wednesday.
Okay, Ray. Have a great week.
You too. Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital, joining us live this morning.